Thanks very much. I'm Dr. Courtney Howard. I'm an emergency physician in the subarctic, and I'm the vice chair of the Global Climate and Health Alliance. So in 2023, as many of you know, my subarctic hospital was evacuated due to wildfires. We required a military plane to take our inpatients all the way down to Vancouver. Climate change has long been called the biggest threat to global health of our time, as well as to health systems. I also live downstream from Ariel. We have never done a proper study into the local health impacts of the oil sands on Indigenous communities. So we haven't well counted their health impacts. And even despite that, we know that at least 5 million people die every year from fossil fuel related air pollution. Just today, school children in Delhi have been told they can't go to school because the air pollution is so bad. So we know that if we were to actually cost out these impacts, it would be fossil fuel subsidies by G20 countries cause health impacts 6 times greater than the cost of the subsidies themselves. And if we redirected those subsidies, we could more than provide health care for all. So within the health community, really what we're starting to say, unfortunately, about fossil fuel companies, I appreciate your kind perspective. We were kind when we were medical students too, and people were saying, hey, meet with the pharmaceutical companies, you're gonna learn something from them. When we actually did the studies, we showed that it changes doctors' prescription practices in a way that doesn't serve our patients. And so 2 things. One, we know that when we frame climate change as a health issue, it's the best way to increase support for it and amplify overall ambition across countries, across political parties, across ages. So I'm really hoping that the Canadian delegation is using health framing and looking for ways to put health language into all of the different negotiation streams. And we need to be clear that fossil fuels are killing us. And that means we may have to have some difficult conversations, but really, this is about our kids. I had a long conversation with really the world's experts on health systems adaptation a couple of days ago. Consensus was we cannot adapt to where we're going. I went to medical school because I love being a doctor. I want to be able to have the tools of my trade, the pharmaceuticals I need, proper health infrastructure till the end of my career. I want to be able to provide a C-section for all of the little kids who are being born right now if they need one when it's time for them to bear their children. If we want that, we need to be clear that we need to sprint towards adaptation and we need to sprint towards mitigation, and that means we have to have some clear conversations around fossil fuels, because right now fossil fuels are killing us. Thank you.
Thank you for that perspective, and I don't want to diminish for a second when I say that it's important to have voices at the table. It does mean as well that tough conversations are had, but the voices need to be there to have those tough conversations. So I very much take your point and your perspective around the health impact, because I think we've been talking internally that this, it feels like that this has been an underutilized metric in our climate ambition. Because as you said, this is a nonpartisan issue. This is, the health impacts is something that we can all relate to, that we can help, that all countries, that all governments, that all people can understand. And the degree to which we are doing our best in terms of bringing those metrics, bringing those numbers, and bringing that reality to the negotiating table will matter. I don't think we're at our peak yet on that, and I think we have real work to do, and I would be really interested to sort of sit down with medical associations and with people who are on the front line of this so that we can do that better, because I think as negotiators we can be better on that, and I think it's such a compelling argument to use in a room about what those impacts really are. I was reading the same study, the same reporting around school children in Delhi. I've lived in Dhaka, and I know exactly what it's like for people to live with that kind of climate, with that kind of air pollution every single day. And I think bringing that to the table is a very personal way for us to be able to cut through some of the politics of negotiation. So it's a very long-winded way to say we totally hear you and totally accept that.